Welcome to the NHF podcast on migraine and headache-related disorders. My name is Abraham Penrod, and I am joined by my colleague Akosa Stokes and our guest, Dr. Don Marcus. How are you doing, Dr. Marcus?
Well, thanks. It's always fun to talk about fibromyalgia and migraines.
Dr. Marcus, if you'll just give us a definition of what fibromyalgia is and what its relationship is to migraine.
Sure. The term fibromyalgia actually comes from the Latin root fibro, which means fibrous or connective tissues, and the Greek roots myo and algos for muscles and pain. So fibromyalgia literally means a pain that affects the muscles and connective tissues. And since the body is basically made up of muscles and connective tissues, this gives people pain all over. Now, the name fibromyalgia doesn't fully describe the other disabling symptoms that people with fibromyalgia typically experience, things like fatigue, poor sleep, bowel problems, and difficulty with concentration and memory that's sometimes called fibro fog. And about half of those with fibromyalgia also have migraines. So it really is a very complex syndrome that affects a lot of different areas of the body in addition to pain. Now, we conducted a survey of about 100 fibromyalgia patients, and 76% reported that they were having troublesome headaches, and most of them were actually experiencing migraine. So migraine was found to affect about half of fibromyalgia patients. If you look at the flip side of that, studies also have shown that having migraines puts you at higher risk for having fibromyalgia. For example, about 5% of the general population has fibromyalgia, and if you look at typical people with migraines, about 17% have fibromyalgia, and that figure actually doubles among those individuals with chronic migraines or migraines that are occurring about every other day, with about 35% of those having fibromyalgia. So fibromyalgia and migraine often go hand in hand.
Well, I guess we'll go ahead and get started on some of the questions that we had. Rebecca from Illinois wanted to know who best treats fibro and migraines.
Both migraines and fibromyalgia can often be very well managed by a family doctor. If you have a doctor who's treating you and isn't really sure what's causing your symptoms, and you think you may have fibromyalgia but you're not getting that diagnosis, then it can be a good idea to have a consultation with a rheumatologist or a neurologist to see whether there might be an additional diagnosis in there. And a rheumatologist is often the first choice as a good specialist to get that diagnosis and to make sure that the other symptoms that you're having besides migraine symptoms aren't being caused by something else. Now, once the fibromyalgia diagnosis has been made, a primary care doctor can actually be a great resource for managing the syndrome. And again, if it seems like you and your doctor are just getting stalled in your treatment, then that can be a great time to meet with a specialist to see what else might be done to help with either the migraine or fibro symptoms.
Well, I guess we'll go ahead and go on to Darcy's question. She wanted to know, is there a theory as to why migraine and fibromyalgia often appear in the same patient?
Yeah, one of the great things about fibromyalgia is there really has been an explosion in research looking at the biology and the physiology of fibromyalgia. And years ago, people looked at fibromyalgia as though it was more of a psychological condition, and now people really understand that it truly occurs because of important biological changes happening in the body, with changes in chemicals, changes in muscles, changes in hormones, etc., that seem to result in all of those different symptoms that occur during fibromyalgia. A number of the chemical changes that happen in the brain and nervous system are very similar for migraine and fibromyalgia. So changes in chemicals like serotonin and dopamine occur similarly in both syndromes. And many people speculate that because there are similar changes in those chemicals and other nerve chemicals and pain levels, that may be why you're seeing that comorbidity between migraine and fibromyalgia, that people are getting both of those syndromes occurring together.
Very interesting. I guess it's a good reason why depression would factor into that.
Basically, all chronic pain syndromes tend to be linked with mood disorders like anxiety and depression. And for some years, people thought that people developed a mood disorder and that led them to be at higher risk for having a chronic pain problem. And then people thought, well, maybe it's the other way. You develop a chronic pain problem, become very frustrated, and develop a mood disorder. And now we know that it really seems to be very much bidirectionally. If you have a mood disorder, that actually puts you at higher risk for developing chronic pain problems, but having pain problems also puts you at risk for developing mood disorders. And because it goes bidirectionally, it really can become a vicious spiral that, let's say you started out having migraines and then you start having problems with anxiety or depression. That will only make the migraine condition worse, which then will make your mood disorder worse, and it really can be, sort of a downward spiral from there. And the same thing really is true for fibromyalgia. So it's important for people to recognize when they have a condition like fibromyalgia, and if a mood disorder is part of that, not to sort of bury that under the rug and just try to ignore it and hope that it gets better, but to really recognize that it's important to treat those symptoms too, because all of those symptoms really aggravate the other symptoms that go along with fibromyalgia as well. And a lot of the chemicals that are important for pain transmission in migraine and fibromyalgia are also important for our mood. So often you can, be treating the underlying condition and find that there are improvements in a whole host of symptoms, including pain as well as mood disturbance and sleep disorders. It also goes along with, having problems in those neurochemicals.
Looks like we have a question from John in South Carolina. How does fibromyalgia start, and can you have the fatigue and headaches without the body pain?
Yeah, usually with fibromyalgia, it really is very much a combination of whole body pain as well as other symptoms like fatigue, headaches, bowel and bladder problems, etc. Now, having said that, people don't necessarily have all of those symptoms occurring every single day, and in some cases, pain is actually not the most problematic symptom. There was a really nice study that was conducted at the University of Oregon where they asked individuals with fibromyalgia, what's the one symptom that you really need to have treated? And only about half of the patients actually chose pain as the main symptom. And people tended to choose other things like fatigue, sleep problems, and even fibro fog. So I think sometimes we focus on fibromyalgia as being a pain syndrome, but for many people, pain really isn't the predominant symptom, although in general, you are going to have a widespread body pain as part of that fibromyalgia syndrome.
Thank you. Our next question comes from Amanda in Baltimore. Have there been any treatments from the headache prevention side that has been found to be successful in treating both headache and fibromyalgia, like Topamax or other seizure medications?
Yeah, the new guidelines actually just came out the other day from the American Academy of Neurology talking about, migraine prevention therapies, and did target Topamax as being a very effective drug for migraine, which it is. And interestingly, although there are some important chemical similarities between migraine and fibromyalgia, some of the drugs actually are a little bit different, and Topamax generally would not be used to treat fibromyalgia. Some of the other nerve-modulating seizure drugs or epilepsy drugs like gabapentin and pregabalin or Neurontin and Lyrica actually have been shown to be very effective for fibromyalgia. They have some effectiveness for migraine, but are not as effective as some of the other prevention therapies. There are also some of the newer antidepressant medications, which again work a little bit better for fibromyalgia than they do for migraine, but you can sometimes target both of those symptoms, with the same medication. The other thing to remember is for both migraine and fibromyalgia, non-medication treatments often can be very helpful. Things like weight management, sleep regulation, avoiding nicotine, exercising, and learning pain management techniques like cognitive behavioral therapy. For fibromyalgia, those treatments really are the core foundation of treatment, and medication supplemental on top of that, whereas for migraine, you often can get a little bit better bang for your buck with the medications, with those non-drug treatments also facilitating benefits and symptom control.
Okay, well, I'll switch gears here just a little bit and talk about the extra sensitive triggers that migraine and fibromyalgia patients share. So Laura wanted to know, how can it be that there is such a broad range of triggers for both migraines and fibro flare-ups?
Yeah, in general, the brain and nervous system likes stability and likes sameness. And as humans, we find sameness to be very boring, and we like to have change and excitement in our lives, even if that excitement is, I went out to dinner tonight. So instead of eating my usual food at home, I waited an extra hour and went out to dinner, which we might find as a treat. But from our brain's point of view, that change is a perturbation in the system. So the brain in general likes things to just always be the same and unchanging. And when things change, that acts as a stimulation to the brain that can trigger our pain conditions like migraine and fibromyalgia. Now for folks with fibromyalgia, they also tend to be extra sensitive. And it's not just that they're emotionally sensitive, but physically they're more sensitive. Their nervous systems react more than do people who don't have fibromyalgia. And there have been studies that have been conducted both in animals and in humans that show that having fibromyalgia very clearly changes the pain threshold, making people more sensitive to pain than people who don't have fibromyalgia. And not only do the people say, it starts to feel something is painful earlier than someone who doesn't have fibromyalgia, but if you do brain imaging studies at the same time, you can see the brain is reacting differently in those fibromyalgia patients. So there's a change in their brain chemistry that makes them more sensitive to a lot of those things that Laura had mentioned. And unfortunately, it's a whole host of different stimulations that can be happening outside of our environment, inside our body, that our body may be reacting to. And that, I think, is why it can be so frustrating, because there can be a lot of different reasons that today can be a bad day, or your migraine can get triggered, or you could be having a fibro flare. Sometimes there'll be triggers that you can identify, sometimes not. But again, trying to keep yourself on a regular, even keel, trying to keep the exercise going every day, sleeping regularly, eating regularly, not having perturbations like, smoking cigarettes here and there, those changes that the body doesn't like, are the best way to try to keep things on an even of a keel as possible to give you that stability that helps the brain from being so overreactive.
Is there a recommended exercise plan that maybe you have implemented in some of your fibromyalgia patients that's been effective for them? Is there a certain level or intensity that you should probably start off with?
Yeah, absolutely. Years ago, we used to really focus on aerobic exercise for fibromyalgia patients, and aerobic exercise is still known to be important and is an important part of an exercise program, but it's become clear that you really need to include as part of your exercise program strength training as well. And in general, what the recommendation is to alternate a day of aerobic exercise and then a day of strength training about 5 days each week. So 3 days a week you'd be doing an aerobic program, and then the alternate days you would do a strength training program. Ideally working up to a target of exercising a total of 30 to 60 minutes on a day, although that doesn't have to be done all in a single session. Now when folks are first starting out, many people are not able to just sort of jump into a 60-minute-a-day aerobic program, and really we discourage people from trying to do that because it's often too much. It's too fatiguing, you're going to flare up, and you'll never want to exercise again. So in general, there's a program that was developed for individuals with chronic fatigue syndrome that also seems to work well for fibromyalgia as far as an aerobic exercise target. And most people will choose walking as their preferred aerobic exercise, so we'll just use walking as the example here. And what you first need to do is to identify how long you can typically walk without becoming fatigued and without having your pain flare. And let's say you can walk comfortably for 20 minutes. Then that becomes your comfort zone that you'll be using as your base. So when it's a good day, what you'll do is you'll walk for 75% of your comfort level. So in this case, for 15 minutes. You'll then rest for 15 minutes and then walk for another 15 minutes. And again, you may not be able to start at that level, but you may be working up to that. And your starting point, maybe a comfort level of 10 minutes. So that's what you would be doing on a good day. Then there are going to be those days where your pain is flared up or you're very fatigued and you really don't feel you can do the normal exercise that you would typically do. And on those days, you don't want to just try to do your regular exercise because you'll probably flare up, and then we'll sort of get behind in everything and then try to overdo, and things will flare up and it'll just be very ugly. So instead, on a bad day, what you'll do is you'll take whatever your comfort zone is. So if it's at 20 minutes, you'll do half of that. and then you'll rest for half that time, and then you'll do that half time again. So on a good day, you'd be walking 15 minutes, resting 15 minutes, walking 15 minutes, and on your flare days, instead of doing nothing or trying to do that 15 minutes, you would do 10 minutes, rest for 10 minutes, and then walk for 10 minutes again. And if you started doing that and said, wow, I'm really flaring up, this just really seems to be too much, that would be a good opportunity to say, I really need to, move down my comfort level. Obviously, 20 minutes is too much for me. What really is a comfort level, and start from there. And with fibromyalgia in particular, it's important to really, start low and go slow, and not to really try to do too much, advance too quickly, but to really stay at the same level for 3 or 4 days before, trying to make a very small increase, to work your way up to what your eventual target's going to be.
If you have some patients that are completely disabled to a point where maybe they have a hard time getting around, would there be something that you would suggest that they could do, maybe while they're sitting down or in their bed, or just standing up or standing still, any type of exercises that you would suggest?
Yeah, I mean, it's really important for every fibromyalgia patient, regardless of their current level of ability, to get started with an aerobic exercise program, assuming that they're physically able to do that and they have medical conditions that would preclude that. But even if it's, walking a short distance. So for many of our patients, for example, when they would start out, I use 20 minutes because 20 minutes is an easy calculation for me to divide into 3/4 and a half. But for many patients, they can walk a block or a half a block, and then they're just done for. So if half a block is what you can walk comfortably, then that's your comfort level to start from. And just, okay, I'm going to get up today. I'm going to walk, that 3/4 of my half block, sit down and rest, and then I'm going to, walk it back. And that's going to be it for today. And I'm going to do that every day for the next week, and then I'm going to start increasing that until I get up to, a block being my comfort level, and then increasing from there. But it's really important, particularly for fibromyalgia, that exercise be a strong core foundation of the treatment to really maximize your benefits.
Okay. Could you suggest maybe some treatments that also would help with this?
Yeah, fibromyalgia is actually really interesting. Some of the same treatments that help with migraine can be helpful for fibromyalgia, but there are treatments that tend to work better for migraine and some that works better for fibromyalgia, which is a little bit curious, and we don't really understand why. But just like some of the medications work better for migraine than they would for fibromyalgia, the non-drug treatment is also a little bit different. Relaxation and biofeedback are fabulous treatments for migraines. They're very effective as prevention therapy and actually work as well as any of the prevention medications that are out there. They're not quite as effective for fibromyalgia for reasons we don't really understand. And for fibromyalgia, the focus is more on cognitive behavioral therapy and operant behavioral therapy. And those are both taught by a behavioral psychologist who helps to reschedule your day, look at how you're reacting to your fibromyalgia pain, and changing your attitude about it. So for example, let's say you go to the mall to buy a prom dress with your daughter, and you're out for half a day. It's just a nightmare. You get home, your fibro is all flared up, and you say, it was awful, I can never go shopping again. With cognitive behavioral therapy, the therapist would work with you to sort of restructure that and to think, okay, what was it that made today so bad, and how can we change that for the future? So that instead of the thought process being, I will never shop with my daughter again, to really come up with some strategies of how you might be able to shop more successfully. So limiting the amount of time you were out, maybe only going to a single store, being there for 15 minutes, taking a break, going to the food court, doing some stretching exercises, going back for 5 minutes and going home, whether you bought the dress or not, maybe doing some relaxation techniques along the way, but trying to problem solve is really very helpful for the fibromyalgia patients and is a big focus of behavioral therapy for fibromyalgia.
Okay. Talk a little bit about acupuncture and seeing a chiropractor or a massage therapist.
Yeah, I'll answer the easier questions first and leave the chiropractor for last.
Okay.
That's actually a more difficult question. But There have been several types of massage that have been shown to be beneficial for fibromyalgia in very small studies that have not been well controlled. So it's hard to give really strong recommendations of yes, massage is going to be helpful or no, it's not. Massage may be helpful, but the only types of massage that have been shown to be helpful have been those that have been specifically given by a physical therapist. So, more of a massage that's focused on, specific body structures, lymph drainage, etc. So going to, your local, your local spa and getting a massage may feel temporarily good, but it's probably not as likely to give you long-term fibromyalgia benefits as if you had massage delivered by a physical therapist. That may be something to consider. Again, is not likely to be nearly as helpful as an aerobic exercise and strength training program. Mm-hmm. Acupuncture has actually been very well studied in fibromyalgia and has quite consistently been shown not to be helpful for fibromyalgia symptoms. So generally, patients with fibromyalgia are not encouraged to see an acupuncturist for their fibromyalgia. The one exception to that is some patients do find that acupuncture can be helpful for insomnia. So some fibromyalgia patients will work with an acupuncturist for insomnia benefit. But as far as other symptoms of fibromyalgia, acupuncture has really been shown not to be helpful, and it's probably not worthwhile spending resources there.
Okay.
Chiropractic has not been studied in fibromyalgia, and I think the chiropractors may or may not be helpful. In general, with pain conditions, chiropractors tend to be the most helpful for short-duration pain syndromes, less helpful for long-term chronic pain. So if you have an acute back injury, you're more likely to get benefit than if you have had 3 back surgeries and you're still having chronic low back pain. Mm-hmm. Part of the issue with chiropractors is unlike physical therapists who tend to have fairly similar treatments across the country, chiropractors often can be very different in what they're, the type of treatments they're administering depending on what school they trained in. So some chiropractors actually function very much like a physical therapist, will be doing a lot of myofascial treatments. Others will not, and they'll be doing more joint therapy, and it really depends on where that chiropractor trained and what their focus is. So it's often very difficult to recommend or discourage going to see a chiropractor unless you know that particular chiropractor and what he or she tends to do as part of their treatment. So chiropractic recommendations are often a bit more difficult. Really hasn't been studied well in fibromyalgia, so that there's really no data out there. Is it likely to be helpful or not? Now, one of the things that chiropractors often do is also prescribe nutritional supplements, and some nutritional supplements actually have been evaluated for fibromyalgia. The most helpful are actually melatonin and SAMe. So if fibromyalgia patients were interested in trying an herbal therapy, those might be good ones to start with.
Now, I know melatonin helps with sleeping, and I guess there is a lot of problems with fibromyalgia patients actually getting a good night's rest simply because of the pain.
Yeah, it's actually interesting you should mention that. They've actually looked to see whether people who have fatigue with fibromyalgia also have sleep problems. Am I fatigued because I'm not sleeping well? Am I fatigued because I'm having pain? Am I not sleeping because of pain? And interestingly, although those symptoms often go together, they don't necessarily go hand in hand. Mm-hmm. So if people, for example, may have fibromyalgia and actually be getting an adequate amount of sleep and still be very fatigued. So it's not entirely clear, why those symptoms don't necessarily go together. For the fatigue, for example, there are changes in the amount of different fibers in the muscles. There are some that control how quickly muscles contract, others that control being able to keep a contraction going for a long period of time, and that balance is actually off in patients with fibromyalgia, and that may be part of the fatigue. So in some sense, those symptoms actually occur separate from each other, although they often do occur together. My point is that you may improve your sleep and be sleeping fabulously and still have problems with fatigue or still have problems with pain. With the nutritional supplements, there haven't been a lot of studies done looking at, what's helpful, what's not helpful. The one that has been the best studied has been SAMe. Again, melatonin makes good sense to take. Coenzyme Q10, which has been studied for migraine. Vitamin C and sometimes vitamin D have also been shown to be helpful in some small studies. So those might be, supplements to get started with for people that are interested, in adding some supplements to their therapy. Having said that, it's unlikely that the supplements in and of themselves are going to be making a huge impact, and really they should be added on top of that strong foundation of, the exercise strength training program and learning the cognitive behavioral therapies.
Okay, fantastic. Thanks for addressing that. I'll go ahead and ask another question from Amber from Washington. She wants to know if they've discovered a genetic link with fibromyalgia.
Yeah, they've actually done a lot of studies of late looking at genetics actually for both migraine and fibromyalgia, and no one has found a specific fibromyalgia gene yet, but it's very clear that fibromyalgia definitely runs in families. And studies tend to show that if you have fibromyalgia, it's likely that 1 in 3 of your children will also have fibromyalgia. So there is this family tendency suggesting that there are likely going to be genes involved. The genes that are currently being investigated as possibly being related are those affecting brain chemicals like dopamine. So in the future, we'll be learning more about whether there is a genetic link that's been found or not, but suffice it to say there probably are genetic links. We're just not really sure what they are yet at this point.
Okay, so I'll go ahead and ask the next question from Myra. Is there an antidepressant that targets dopamine more effectively for this disorder than one that targets serotonin?
Yeah, there are drugs that tend to affect different nerve chemicals, separate from others. And it's really unclear which brain chemical should be the one that's being targeted. And I think part of the reason is for some people, drugs that are affecting serotonin seem to be more important. For others, dopamine seems to be the more important chemical, and for others, norepinephrine. And unfortunately, the only way to discover that is to see how one responds to different types of medication treatments. So in general, if people are being treated with antidepressants for fibromyalgia, the best thing to do is to take whatever the first antidepressant is your doctor is prescribing, see how it works, give it a good try. If that's not working, then for the next trial of an antidepressant, to choose one that targets a different transmitter. So if you used one that was a serotonin drug, maybe trying one that affects norepinephrine more or something that affects dopamine more may work better for you. And that's not to say it's going to work better for everybody, but it really needs to be matched to your particular brain chemistry.
Okay. Well, is there anything else you wanted to add for research that fibromyalgia patients could consider potentially?
Yeah, I think one of the important things to remember if you have fibromyalgia is not to get discouraged. And there really has been an explosion of research looking into fibromyalgia, what's causing it, what to do about it over the last few years. And that's really good news because it's really helped to show us what's happening with fibromyalgia and suggested new treatments. And that will continue to develop into new treatments in the future. Recently, the American College of Rheumatology broadened the diagnosis of fibromyalgia and changed the diagnostic criteria to include a range of symptoms, including pain, fatigue, abdominal pain, fibrofog, and depression, to see whether that may help identify people with fibromyalgia who currently are not getting that diagnosis and consequently not getting treatment. And there are a variety of centers, including us, who are currently doing some work investigating how well these new criteria work, and hopefully we'll find that they're very helpful, and this will make it easier for people to get that fibromyalgia diagnosis. Some of the most important research with fibromyalgia that's going on is showing clear links between biological changes in pain perception and pain physiology in people with fibromyalgia, showing that the brain is more reactive to pain stimulation and changes in the nerves, muscles, and hormones that really help to explain the wide range of symptoms that people have. And this research, I think, is really important for folks to be aware of because it helps to show that fibromyalgia truly is a real physical, biological condition. It's not just that one is choosing not to do things or exaggerating symptoms, but very clearly there are physical changes happening in these people, and once we better understand those physical changes, then that will really bring new targets to address treatment to.
Okay. Well, are there any additional books or any additional resources that you could point anybody to help them out with to kind of add on to the conversation today?
Yeah, there's some really great websites available for fibromyalgia. For migraines, obviously, headaches.org is a great site. For fibromyalgia, you can go to the National Fibromyalgia Association website, which is fmaware.org. There's also the National Fibromyalgia Partnership, which is fmpartnership.org, and the Fibromyalgia Information Foundation, which is myalgia.com, and I always have information of fibromyalgia on my site, which is dawnmarcusmd.com. And of course, there's my fabulous new book, The Woman's Fibromyalgia Toolkit, which is a great resource that helps to tie together what do we know about the biology of fibromyalgia, what do you need to be doing as far as medications, and what are different non-drug treatments that you can be doing. So we have an exercise routine in there. We have a yoga program in there for folks to do that's been shown to be helpful for fibromyalgia. We have a lot of resources that helps you get started with cognitive behavioral therapy and relaxation, et cetera. So it really is a nice one-stop shopping resource to put it all together.
And they can get that book on your website and on Amazon.com?
Right.
Fantastic. Well, Dr. Marcus, I appreciate you joining us today, and thank you for all the great information. Anything else you'd like to discuss or talk about before we sign off?
I think the important thing is just to recognize if you're having a lot of troublesome symptoms, if you have migraines, but you're also having, fatigue, sleep problems, a lot of other body aches and pains, so don't just hide those under the rug. Be sure to bring those up to your doctor and to see, do I have fibromyalgia? Is there something else that needs to be treated? And if you're a long-standing fibromyalgia sufferer and you've had fibro for a long time and have been through treatments and they haven't worked before and you're really becoming discouraged, to know that there are a lot of new treatments out there, both drug and non-drug treatments. So to really make sure you're invested in treatment, get back to your doctor and say, hey, I'm still having my fibro symptoms. What can be done? Because there really are a lot of good treatments out there to take advantage of.
Well, thank you for being our guest today. We appreciate it. Hopefully we can have you on the podcast in the future.
Thanks so much. I'd love to come back.
Thank you.